Hello to everybody. Today I'm happy to present Oya Şişman, who is a hair transplantation specialist.
Thank you.
Actually, the favorite one for Experts Medical, because we had many patients who are very happy with the result.
Thank you.
So we are very grateful to you for your work.
Thank you.
Could you tell please a few words about yourself? How long are you doing hair transplantation and how many of them have you already done?
It's a long time. And I cannot tell you exactly how many patients we did till today, but I can tell you when I started to do hair transplant, it was 2003, and we were doing the old technique, FUT, maybe you heard about it. We were taking the skin from donor area and we were separating the hair follicles by one by, and we were putting there.
Mm-hmm.
Quite long time in all over the world we did FUT technique, and like 2005 to 2006 we started to take the hair follicles by one by, follicle unit extraction, we call it FUE. And when we take the hair follicles out, we were opening small incisions and we were putting all the hair follicles back. And I can tell you, like last 4 or 5 years, we started to put the hair follicle back with DHI technique. And we still take the hair follicles out with like the old technique FUE by one by. But when we started to put the hair follicles back, we use special pens. We call it choi. We put all the hair follicles by one by in the pen, and we put hair follicles back under the skin by one by with these special pens. There are two techniques. One of them we open the incisions, and the other one choi, DHI. Both of them are available. We do both of them. The operation takes like 7 to 8 hours, depends the hair follicle number. And after hair transplant operation, one night we offer to rest, and the other day we open the bandage, we teach them how to wash their hair, and then all the patients can go back. This is what we do approximately in per year, maybe 1,000 or more than 1,000 patients we do hair transplant. Minimum. Yeah, of course it depends, the pandemic or that kind of situations. It changed the number, but approximately I can tell you that. Yeah, it's a long time for me.
And you use the new method, the DHI.
Yeah.
Is it better as a result for the patient, or what are the preferences of this method compared to the FUE?
Yeah, we take with the same technique, FUE, but in DHI, during the DHI technique, we don't use any liquid under the skin. We do just local anesthesia. So that means after hair transplant, after DHI hair transplant, there is no risk for the edema. Could be some swelling, after hair transplant. So we give very small amount of liquid, so there is no swelling. This is the first advantage for me. And the second one, the incisions are round. That means hair follicles feel better under the skin, because the incisions with the pen is round, so the hair follicle feels much more better and recover fast. With the old technique, maybe we could see result between 6 and 8 months, but with the new technique, till 6 months, sometimes 60, sometimes 80% of the hair starts to grow. So we see the result quite quick, and the recovery is very fast. The transplant area recovering very fast than the FUE. So there are little bit differences between FUE and DHI. It's getting better and it's getting faster with the DHI.
Can we say that with DHI technique we preserve more hair than with FUE? I mean that more hair stays after DHI than after FUE?
Oh, I can tell you that. The most important thing, the donor area. Okay, we usually try, if the patient has a small bald area, we know how many grafts if we need. But if the patient has a big bald area, we have to take the maximum hair follicle from the donor area. So there is no problem for the graft number. Is no problem. The technique. We are trying to take the maximum hair follicle from the donor area. This is the most important part for us. Doesn't matter how many hair follicle we will put back, you know, because after a few months the donor area should be covered, should be recovered. So we shouldn't give any damage to the donor area. It should be same in a few months. So we are trying to take the maximum hair follicle number without giving any damage to donor area. Doesn't matter. Sometimes it's able to take like 4,000, 5,000 hair follicles. If it's available, we took and we put them back with DHI or FUE technique. No problem for us. The most important part, donor area.
I mean, I heard that after DHI technique, like 98% of the hair that was transplanted still grow.
Yeah, you are right.
And after FUE technique, it can be a bit more damaged.
Exactly.
So
exactly.
some more fall down.
Exactly. I can tell you, like, if we lose like 10% of hair follicle during the FUE, with DHI maximum 2 or 3% of the hair follicle we damage, we can lose. Otherwise, all of them will be grown. Yeah, you're right.
And do we have difference? I mean, after DHI technique, will the appearance will be more natural than after?
Sure. I understand what you mean. We need to during the operation for hair transplant or eyebrow hair transplant or beard transplant, mustache, no problem. We have to follow original hair. You know, if we follow the right angle and root with the original hair, it seems so natural. It's same, for example, the eyebrow transplantation. It's able to see the original hair. Doesn't matter if patient has any hair there. It's able to see the original angle and weight. So if I follow the right angle for eyebrow, beard or hair, it seems so natural.
And how long the transplanted hair is continues to stay on the head? I mean, maybe the patient continue to lose hair and continue to lose the new transplanted hair as well?
If the patient has their own hair, and you know, it's 99% of the baldness reason is the genetic. So sometimes patients, when they come here, they have some hair. After hair transplant, they can lose their own hair. So usually we offer the patient to use some vitamins, to do some treatments, and to use some anti-hair loss products after hair transplant, because we would like to keep their own hair. Okay, because the hair transplant hair will grow. They don't need any treatment to grow. They will be already grown. But the patient can lose their own hair, so we don't want it. During the time they can lose their hair, so they can need to second hair transplant. But the transplant hair will stay forever. If the patient has any health problem, of course, could be everything. Otherwise, there is no reason to lose the hair transplant hair.
So would I be right if I say that the patient can continue to lose his own hair?
Sure.
But he will not supposed to lose the new transplanted hair?
Exactly, because this part of the hair has a code. They have a code to not fall down. So when we change their places, they still have the same code. We don't lose them. Yeah.
And what measures the patient can apply, you said, about the treatment in order to help the hair to grow more fast and to not lose his own hair? And
of course, we offer some treatments. Always, I offer to do, what kind of products they have to do, what they should do. Usually the patients do what if we say, so they can't lose their hair if they do something like that. You know, this is genetic. The body tells you you will lose it, so we are working against the genetic. Yeah.
So it's about the cosmetic products, or it's about procedures like PRP or something like that?
Sure. What is available for the patient? For some patients, it's easy to do PRP. If they say no, it's not easy, so we can offer some products to stop hair loss and a special shampoo and some vitamins a few times in a year. I can offer.
It's like a course, like 1 month course or 2 months course that he should take once a year, or it's a regular, continued treatment?
Of course, it depends. If the patient still has a hair loss, very strong hair loss, they should use for a long time, of course, to stop hair loss. Usually, if the patient like 1920s, early 20s, if they start to lose hair loss, it goes so fast. So there is no reason to use some products because they will fall down in a very close time. But after 30s, if the patients start to lose their hair after 30s, I absolutely can offer some products, because if they don't use, maybe they will be bald like when they are 35. But if they use something, we can have time till maybe 40, 45 years or so. I just offer, it's up to our patients. They decide by themselves, because it's a long time. We are fighting with genetic.
Right. Would you recommend to do PRP during the hair transplantation, and after that when they go back home, or it's not real sense?
If it's available, if it's not difficult for the patients, we do already here one treatment. So after hair transplant, I can offer 3 or 4 PRP treatment in their country every 3 weeks. If they can do it, of course it will be helpful to grow on the hair. Otherwise, like after 2-3 months, they can start to use some anti-hair loss sprays. They will be helpful too.
And when we can expect the result after the hair transplantation?
We need time. Everyone different than each other. The result will be changed for body to body, and of course the graft quality changes the result. If the patient has a very thin or very small hair follicles, maybe it will take like 6-8 months. But usually, if the patient has a good quality hair follicle, after like 2-3 months, they will start to see the result. But in 1 year, the hair transplant result will be able to see in 1 year. After 1 year, we can understand what happened. Sometimes, especially for the crown area, we can tell like 14th to 15th month. At the end of the year, we will see the exact result.
And if a person, for example, works with people, and when he can go back to work without feel ashamed and with normal appearance?
It depends, but like after hair transplant, of course there will be redness here, but with DHI it's able to do the hair transplant operation without shaved hair. So we don't have to shave all the hair. This is a good advantage actually. We can work between their hair. So there will be red part here. Usually, I cannot promise, but usually like in 2-3 weeks, there will be no sign about hair transplant on their donor area. So if they don't mind about the redness here, pardon, like in 1 week they can go to work, no problem. If they work in a dirty, dusty areas, they can use a bandana or they can use a hat or a bonnet, will be helpful. Well, of course, I offer like 2 weeks, don't do very heavy jobs. This is my offer, but if they have to, of course, they have to work. But like 1 week maximum, I can tell you, they can continue their life, social life, no problem.
And some of our patients ask, because they are a bit worried, after the hair transplantation, could they sleep normally on their head? Because some of them say, no, will be able to sleep only sitting position and so on. Is there any restrictions?
It's not easy, of course, but like 2-3 nights, better to sleep on their donor area. Okay, we will do a big bandage, it looks like a pillow already, and we will give a neck pillow, so it's better to sleep on their donor area, you know, because if they go to very deeply sleep, they can touch the transplant area and the hair follicle can come out, so which we don't want it. Just they have to be very careful when they go to sleep, that's it.
Right, and you take the hair from the donor area.
Exactly.
Is it right that this hair regenerates with the time?
This is an organ transplantation actually. When we take the hair follicles out, we put directly here. So there will be small bald areas here, but it's so small, it's not visible. It's, you cannot understand where we take the hair follicles out. So the hair will be covered by their hair. It will seem in a few months like when they come to Istanbul. It will seem like before hair transplant. No one can understand. But when you shave all the donor area, it's still not understandable. You know.
And do you provide any guarantee for the patients who come for the hair transplant?
It's not easy to say 100% guarantee, of course, because we don't know what will happen after hair transplant. Till today, maybe more than 10,000, 20,000 people, we have no problem till today. They didn't complain about anything. But if they have any kind of problem, we will be ready for them to solve the problem. But till today, you know, the medical tourism is the easy job actually, because we do the hair transplant and after 2 days they are going back to their country, so we have to follow the patients from another country, so it's not easy for us. But thank God, till today we had no infection, we had no problem, we had nothing. The most important problem is just the itchy or small acne, that's it. So when the patient has a problem, it's very easy for them to reach us, you know that. So we are trying to solve all the problem, but this is our guarantee.
Okay, and how the patient can come to see you for the hair transplantation?
So all you can contact with the expert medical, and you will be arrange everything. Just give us to the dates, so we will be ready for all the patients here.
Thank you very much.
You're welcome.
I was very, very pleased to speak with you.
Thank you.
And I am sure that it was very interesting for our patients as well.
Thank you. Thank you. Thanks a lot. I'll see you here.